Hello, everybody. This is Gary. Today is January 12th, 2022. It's 4:40 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today, I'm still in a lot of physical pain. Me, my psychiatrist, and my primary care physician decided to put me back on Neurontin, 600 milligrams 3 times a day. Neurontin is also known as gabapentin. Um, Withdrawing it from it caused too much physical pain, and I can't tolerate this pain any longer. So I am going to go back on the Neurontin and take 600 milligrams 3 times daily. In the meantime, I'm also taking Flexeril, a muscle relaxant for muscle pain and spasms. Um, I also have a analgesic gel for my skin for when my joints and my muscles hurt. I forget the name of the medication, but it's an ointment, an analgesic ointment, non-narcotic. Um, I went to the X-ray service today at Highland Hospital here in Rochester, New York. They did an X-ray. They did an X-ray of my lower back to see if I have any pinched nerves and if that's causing my physical pain. The results of the X-rays came back, but I don't understand it. It's all technical jargon to me. So I will ask my primary care doctor on the 20th or the 21st when I see her what the X-rays showed, if they showed anything at all. I already know that I have some slight sclerosis of the spine. My spine is sort of bent, and it's been pretty much lately all my life, but it's never caused me physical pain before. So I don't know if my spine has anything to do with the physical pain I'm in my muscles, my arms, my legs, my joints. Um, I do have arthritis in my left hip, and I know I have arthritis in my upper back. I am 56 years old, and I am getting older. I'm also overweight, so walking with the extra weight may be hurting my legs and my knees. Um, I'm going to have to learn to eat better and lose some weight and exercise more. I did go out for a walk today in the winter. It's very difficult to do that because it's cold out and it aggravates the pain in my joints and it aggravates my arthritis, but I need to get out and exercise. It's part of my daily schedule, which I stick to or try to stick to even when I'm in physical pain. Um, I'm seeing my therapist on the 20th of this month, my primary care on the 21st. I have group next Tuesday. I was supposed to have group yesterday, but it was canceled for some reason. I think the therapist that runs the group wasn't able to show up for group therapy at the clinic. Um, Something held her up, so she wasn't able to be there. So we didn't have group. But I have group next Tuesday at 2:30. At least it's scheduled for next Tuesday at 2:30. Um, there's supposed to be 10 weeks of groups. So because we missed yesterday, I don't know if they're going to tack on an extra week or just subtract that from the 10 weeks or whatever. Um, but I'm seeing my psychiatrist, I believe, on February 3rd. Um, and we will be discussing my medications and the pain that I've been going through. Um, we tried to withdraw me from the Neurontin, but that may have been part of what's causing all my physical pain. Um, as far as my psychiatric symptoms, my hallucinations, my auditory hallucinations are pretty intense. Um, I don't have visual hallucinations. That's not part of my illness. Um, my delusions are pretty intense right now today. When I was outside walking, I thought people were following me when they weren't. Um, my hallucinations are pretty intense. My depression is pretty intense. My anxiety levels are very high. Um, just coping the best way I can by sticking to my daily schedule. Um, it's very bleak and depressing this time of year. Very dark outside, cloudy, very depressing. It's not good for people with mental illness to be in a dark environment, outside or inside for that matter. Um, Not getting a whole lot of sleep because of the pain that I'm in. Insomnia just aggravates my hallucinations and my delusions and my depression and my anxiety. I'm doing the best I can to cope, which isn't easy. But other than that, there's nothing else to report.